Alright, so there's a bit of LGBT plus news from around the world there is to get to. And so this is probably going to be a pretty long video. But anyway, let us start with the bad slash we knew this was going to happen news. And that's what ended up happening when Uganda decided to pass even stricter laws against the LGBT community than they already had. So, I'm just going to go into the article and bitch as we go along. The HIV/AIDS treatment center in Kampala is almost empty days after Uganda enacted one of the most draconian anti-gay laws on earth. The usual daily influx of around 50 patients has all but dried up, says staff. Antiretroviral drugs pile up unused. Andrew Tendo, resident medical officer at the U.S.-funded clinic, warned that new waves of HIV infections were forming even as vulnerable people stayed away from treatment centers after afraid of being identified and arrested under the new laws. Which, yeah, and we saw that coming. I mean, the only people who probably didn't see that coming was the government. And you'll find out why I'm saying that in a minute. The LGBT community in Uganda is on lockdown right now, he said. They have preventative services. They cannot access condoms. They can't access ARTs or antiretrovirals. Under the bill, which President Yoweri Museveni signed into law last week, gay sex is punishable by life in prison, while aggravated homosexuality, which includes transmitting HIV, is punishable by death. And as I mentioned in my previous video about this new law, that would punishable by death, though I'm not pro capital punishment. Punishing someone who knowingly gives someone else HIV, I'm perfectly fine with. The problem is this law goes further. Even if you're not aware of your HIV status and you infect someone else, it is still punishable by death. And why? It's not like they knowingly did that they wanted to give someone else AIDS. They just didn't know their status. So, until this year, the Kampala clinic had been a beacon of success for the fight against HIV in Uganda, where 1.4 million people live with the virus and 17,000 die a year as a result of its ravages, according to the state-run Uganda AIDS Commission. Now, though, when patients do come in, it's often out of absolute necessity, said Tendo, adding that the HIV cases presented had become more severe as people skipped treatments. Uganda's health minister disputed a suggestion from a U.S. official that the law would reverse the country's gains against fighting HIV/AIDS, saying last week that the government would ensure that prevention programs would remain accessible to those that needed them. How? The government of Uganda, now this is a direct tweet from this particular official. The government of Uganda will ensure that prevention programs for HIV epidemic control remains accessible to those that need them in a non-discriminatory manner, observing principles of confidentiality and equity. And how are you going to do that when it's illegal to be gay? Seriously, do you really think someone is going to risk saying that they have HIV in that environment? Even if they didn't get it because they're gay? How are you going to manage that? Seriously, the government itself has to report illegal activity, right? So, how does that work? I just don't know how anybody could possibly believe that. The health minister declined to comment for this article. That's just a shock. They might be held to account. We couldn't have that. Nonetheless, the trend of HIV patients staying away from treatment centers is being mirrored on a national level. According to Mary Borgman, country director for the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, which funds the Kampala Clinic and about 80 other drop-in centers across Uganda. She said fear had increasingly been deterring people from coming in for treatment ever since the anti-gay bill was introduced in Parliament in March. A rare patient visiting the Kampala Clinic said he despaired at the new legislation. I felt so sad when the law was enacted because we fear PEPFAR will cut off funding for the free services we have been receiving, said the 27-year-old gay man who asked not to be identified for fear of being targeted by authorities. Again, perfectly reasonable. Members of the LGBT community are afraid to leave their homes, which means even if the funds are not cut, some will still not seek services, and that's very depressing to think about. Such fears of reduced American funding aren't far-fetched. After Museveni signed the bill into law, U.S. President Joe Biden directed his National Security Council to evaluate the implications of U.S. engagement with Uganda, including PEPFAR. Now, I get that Biden wants to stick it to the Ugandan government, but I don't know. I mean, who are you punishing if you reduce the aid to things like PEPFAR or any other humanitarian aid? Let punish the Ugandan government, absolutely, but why attack the very citizens that Uganda is targeting for just being gay? So I don't see that as hopeful in any way. I know that they said reevaluate, but in the 2021-2022 fiscal year, PEPFAR provided $418.4 million in funding to Uganda, more than half of the country's HIV/AIDS treatment budget. The program has been instrumental in Uganda's progress against HIV/AIDS, which includes a nearly tenfold reduction in mother-to-child HIV transmission over the past 2 decades. PEPFAR estimates its support for the scale-up of antiretroviral treatments in Uganda helped avert nearly 600,000 HIV-related deaths between 2004 and 2022. Borgman said the American government was acutely aware of the impact any funding cuts would have on vulnerable communities, including LGBTQ Ugandans. The review is around whether we can operate within the environment that we are provided with, Borgman said, without elaborating on specific legal concerns. So, yeah. There's something else I want to bring up about this. No, what was it? Oh, yeah, just the fact that the government is aware that mother-to-child transmission exists. Obviously, that means that not everybody who needs HIV services happens to be LGBT. So, why single them out exactly? Yeah. Because if you don't know your status and you are not gay, does that affect you under this law? I do not know. All right. Lillian Mwerko, the East African Regional Coordinator for the International Community of Women Living with HIV/AIDS, said some providers feared that offering medical services to LGBTQ patients could be classed as promoting homosexuality, an offense punishable by 20 years in prison under the new law. Oh, for fuck's sake. that's promoting homosexuality as going to an OBGYN with your straight partner and talking about whether you're pregnant is promoting heterosexuality. What the absolute hell? The Ugandan bill toughened up on existing British colonial era law. I thought you guys were pushing back against imperial rule, under which gay sex was already illegal. Proponents say the new legislation is needed to counter what they allege are efforts by LGBTQ Ugandans to recruit children into homosexuality. Good God, nobody's recruiting anybody. As I've mentioned in previous videos, actually I think I mentioned it in pretty much every one of my LGBT plus videos. When I was growing up, all I saw were either just straight out straight people, or straight couples. And yet I am still asexual. This is nothing about recruitment. Attraction has nothing to do with a recruitment. You are either attracted to someone or you are not. You do not recruit people into that. That is not a thing. And the fact that these Ugandans would scream that this is a Western idea, and that because it's a Western idea and it's a imperialist notion, and that it's the imperials that are trying to stop them from having this law. It just says right here, colonial era British law that you're following. Make up your damn mind. Either you're anti-imperialist or you're following their damn rules. Pick one. The amended version signed by Museveni didn't criminalize merely identifying as LGBTQ as a previous version did, and revised a measure that required people to report gay activity to only oblige reporting when a child was involved. Which I hope that means that only if you're under 18 and you have an underage boyfriend as well. Because, teenagers tend to pair up. I hope that's what it means, and not that these dipsy doodles think that men are having sex with underage boys. I think they're confusing the gay community with the Catholic Church. At the Kampala clinic run by local charity Icebreakers Uganda, medical officer Tendo said he understood the fears of the LGBTQ people in Uganda who often endured painful lives, featuring rejection by their families and arrests. The majority of these people, like transgender or queer people, have gone through a lot already, he added. They wouldn't want to be in a place where they can be raided or detained at any time. Yep, that is very true. And that's why they're afraid to go there, because even though the health minister said, oh, no, that's perfectly fine. We're not going to do anything to prevent you from getting the treatment you need. How are they supposed to believe that? When the government has declared war on the LGBT plus community. So why would they believe that a government-funded clinic is actually going to help them? I don't blame them for being skeptical. So, anyway, that's all I have for that article. So let's get to some, more fun things. So, before I get into this next article, there was a piece done on Elliot Page. Now, a lot of people seem to be of the impression, I'm pretty sure there are a lot of people who are under the impression, I should say, that until they found out that Elliot Page was trans, that he never had those feelings before, like when he was in Juno. And when he was presenting as a female, as a woman, and people thought that, and he even went by his dead name at the time. People never thought of anything, but minute he mentions I'm trans, it seemed like it was a sudden shift, like, because he had previously identified as a lesbian. So this was a shock to people who weren't paying even a nominal attention to his career. I mean, I'll admit it was a surprise to me. The thing is I did not care that this happened. As long as he's happy, I'm happy for him. I'm just not going to say, "Oh, I never knew, this must have just happened out of the blue." No, not going to do that. Never once did I think that. I don't have enough information. But with that ramble, Elliot Page sat down for a piece talking about their memoir called Page Boy, and he discusses his success in Juno, but that he almost quit acting over the pressure he felt to dress and act a certain way. And we know that he came out as trans in 2020, and so in this piece, he talks about the joys and perils of show business. And, you know, I just, oh, what did I want to say about that? Oh, dang it. There was something I was going to say about that. Oh, yes. The fact that he felt pressured to dress and act a certain way. Like I've mentioned in my unpopular opinions video, I wonder how many trans people. Now, again, if you have gender dysphoria, which he obviously did because he did have top surgery, so he obviously does have some sort of gender dysphoria. But for those who don't, and who are feeling like they don't fit into into a certain label that was given to them, what my question is how many of those people would possibly transition, whether it be non-binary or whatever, or transition to the opposite gender, if, again, this is probably mostly for people who do not have gender dysphoria, because that's an entirely different animal. But I wonder if we didn't have these strict gender roles. Like, if Elliot could dress the way he wanted to and still be, go by his dead name, or whatever. Just knowing and still calling himself a woman. Because I just do not see why women cannot dress however the hell they want. I don't see why they need to act a certain way. Same thing with men. Why do they have to, I don't know, bottle up their emotions because men aren't supposed to show emotion, or men aren't supposed to wear skirts or heels or whatever, or makeup? Why not let men dress the way they want? Why is that frowned upon? I'm sure a lot of people who are questioning their gender probably would not if they were allowed to present themselves the way they want, even if it meant having top surgery for a female. I mean, women have to have double mastectomy for cancer, for breast cancer, depending on how advanced it is. They might need a double mastectomy, or they might jump the gun and they have the genetic marker and they want to have a double mastectomy. How is that? A lot of those women, well, maybe a good majority might want to have surgery so they can have their breasts back, so they at least look like they're normal. But not everybody does. Some people are just perfectly fine, like, okay, well, this is proof that I went through this thing, so I'm just gonna be proud of it, I guess. So, how is that any different than a woman who looks at her breasts and think those don't belong on my body and decide to get rid of them, and but still identify as a woman? Because this goes back to, what does it mean to be a woman? Yes, for most people it's just simply a female, an adult female, but not everybody might feel that way. Some people might be more androgynous, and like I said, they might not want to have this, but that otherwise they don't want to completely transition to becoming a trans man. There could be all sorts of variables, and because I'm not that familiar with trans, I'm not going to go into more into it than that, because I probably am sounding dumb to trans people as well. But why do we insist that a woman is this and a man is this? Why do we need to do that? Why don't we just, I don't know, let people live the way they feel comfortable living and not be such judgmental pricks about it? There's an idea. So, on that lovely note, let us talk about this last article that I have about Joe Biden dealing with book bans being on the rise. All right. So, President Biden on Thursday, so that's today, President Biden on Thursday will announce new actions to try to address discrimination against LGBTQI plus Americans, including the appointment of a new point person at the Education Department to address an increase in book bans. Ooh. Too many parts of our country, LGBTQ Americans are being targeted for who they are, and that, simply put, is discrimination, said Neera Tanden, Biden's domestic policy advisor, on a call with reporters. The book ban coordinator at the Education Department will make schools aware that book bans can violate federal civil rights laws if they create a hostile environment for students, Tanden said. Book banning erodes our democracy, removes vital resources for student learning, and can contribute to stigma and isolation. And I saw this piece from CBS Mornings where they talked to children, elementary school children, who had a very, very intelligent discussion about how these book bans are affecting them because of them not having the books they want to read, because the books that they're left with are books they've either read before or they're just not interested in. Maybe it's because it's too low of a reading level for them, which I've mentioned before. That's why book bans are stupid, because just because you don't want your kids reading a certain material doesn't mean that it's not good for any child. Because it depends how mature they are, what their reading level is like, what topics that they're mature enough to handle. And it's not for one single parent to decide. This is why children's librarians are experts at this. They know what's an appropriate reading level. And they might ask the parent for permission to give their child materials that are above that reading level, but that's an individual thing. That's not something that should be forced on everybody. Anyway, Biden will deliver remarks on the issue during a Pride Month event on Thursday evening with LGBTQI+ families on the White House South Lawn. Other new actions being rolled out on Thursday include a community safe program from the Department of Homeland Security to work with LGBTQI+ community centers, clinics, and small businesses like restaurants and bars to provide training for bomb threats, active shooters, and cyber threats. That is so sad that even has to be a thing. An advisory for mental health care providers from Health and Human Services to help provide evidence-based care for transgender youth. Regulations to protect LGBTQI+ kids in foster care and place them in safe and appropriate homes. Alright, so that is the article, quite short. And I am so glad that initiatives like this are being brought up, because it's hard enough to be a kid because other kids can be shitty. But when you're part of a targeted minority, that makes things so much worse, because now you really have everyone against you instead of just feeling like everyone's against you. So hopefully these initiatives do help these kids and these families, and also that they help to reverse these book bans, because again, you don't want your kids reading certain materials. Well, may I suggest putting them into private school? And if you're whining that that's expensive, well, then you just have to put up with the fact that public schools need to teach children about communities that you might not like. That's just the way it is. And sorry if that puts you in a bind, but may I suggest homeschooling so your kids can get into absolutely no college whatsoever and you just ruin their lives, so they can hate you with a fiery passion. Because you're already on the way there if your kid ends up being one of these minorities that you're trying to protect them against, because they're going to end up hating you anyway at that rate. So why not just ensure that any child will hate you? So anyway, I'm starting to ramble again. But that's all the news I have on the LGBT front for today. And I will see you guys in the next video.